Thank you for staying with us, and we're still live on Joy Prime Television. It's still Prime Morning. So on the 15th of February, a day after Valentine, right, was a International Childhood Cancer Day. And if you didn't know about it, if you're sharing roses and chocolates and red dresses and all of that, there was something very important that you probably missed out on. And we don't want you to miss out on that conversation, so we're bringing it here. And this morning, I've got Mr. Emmanuel Amankwa from the World Child Cancer, so Ghana. Welcome. And then I've got Dr. Ernestina Shandov, if I got the surname correct, Pediatric Oncologist. You'd find her at the Curable Teaching Hospital. Thank you, lady doctor, and thank you, gentlemen, for joining us. Again, just give us an overview of the types of childhood cancers that are very prevalent in Ghana. I'll go to Doc.
Okay. Thank you very much for having us, and good morning to your listeners. So childhood cancer, as many of us would know, is cancer that happens in children. Okay, most of the time we think cancer is just like it happens in adults, but childhood cancer is actually curable 80% of the time. If you take 10 children, 8 of them can be cured and live their normal lives and marry and do whatever they want to do. Okay. So that's the difference between adult cancers and childhood cancers. Basically, cancer is an abnormal growth of any part of the body. So with childhood cancers, you can have cancer in any part of the body, in the brain, in the eye, in the jaw, in the stomach, in the legs, anywhere. But there are some that are very common in our environment. One of them is the cancer of the blood, we call leukemia. Okay, we also have cancers of the kidney.
Even in children?
Yes, even in children. It usually happens in preschool children. Before 6 years, they have cancers of the kidney. But their cure rate is very high. Outside, if you take 10 children, 9 of them get cured. Okay. And we also have other cancers, like cancers of the immune system. We call the lymphomas. And then cancers of the eyes. We call retinoblastoma. Cancers of the bone, and cancers of other parts of the body. So basically, with childhood cancer, it's curable when it's detected early. Okay. So the early detection is very, very important to be able to cure the cancer. And as I've said, if you go to the developed countries, cancer is not something so scary because most children get cured. 8 to 9 out of 10 children get cured. But it's not so in our setting. If you take 10 children, maybe you have like 4 or 5 getting cure, mainly because of not even knowing that it's cancer. I mean, having the symptoms and not knowing that it's cancer and seeking care in places where you may not get help. Okay. And by the time they come to the hospital, it may be too late. Okay.
Mr. Emmanuel Amankwa, I mean, a doc is giving me some statistics about if you take about 10 of them, the numbers that can be cured. But overly in Ghana, what's the statistic looking like? Why is it even a worry for us to talk about it?
Well, it is a worry because, as you said, if you present 10 children, 3 or 4 of them will be alive, maybe in 5 years to come. Whereas elsewhere, we have about 8 to 9 of them being alive. Okay. So we need to talk about it because it is estimated about between 1,200 and 1,300 of children will be affected with cancer each year.
Ghana here?
Ghana here. Oh. But between Curable and Konfanochi, with the 2 treatment centers, we only do, last year for instance, we do only 414 patients. So we see that there's a huge gap of these children not presenting. It's because, one, they don't know that maybe it exists, or doctors are unable to detect it early. So we see patients roaming from one facility to the other. Before they end up Curable or Konfanochi, it's too late for them to treat. So that is why the WCC comes in. Okay. So the WCC is a leading international children's charity. Okay. Yes, and we want to address the gap between the advanced countries where we have 10 children or 8 children doing well, and we have
as compared to Ghana. But so how do you intend to do that?
Yes, so we have 4 cardinal points or strategy we are looking at. We are looking at improving diagnosis. We are looking at diagnosing early. We are looking at helping families to cope with the challenges that come with childhood cancer, as well as making a case that more resources need to be pumped into childhood cancer. Yeah. So we are so grateful when the First Lady came in to help us put up a hostel, 3-story building, for 50-bed hostel for the mothers. Because somebody will refer from, let's say, the northern region, Talensi, for instance. We have a patient from Talensi. This patient know nobody in Ghana, Accra. They no relative. She's all alone. So you need some place to stay to be able to help manage the cancer.
Okay. That's some good news, knowing that an institution is taking up the task of making life better at least. But so the 15th, what really happened? Was there anything special that happened?
So the 15th of February, which is the International Childhood Cancer Day, we did a lot of advocacy because we realized that for the lack of knowledge, our children are perishing. So a lot of advocacy on the social media, the TV, the radio stations, and also we sort of commemorated the day by installing the Tree of Hands. Yeah. Okay. So the Tree of Hands basically means that through our hands, we can let these children survive. Through my hands, his hands, your hands, all our hands, we can make these children survive. So basically, that is the symbol for International Childhood Cancer Day, that we all need to put our hands together. So as health professionals, we need to make sure that we diagnose early. If you are confused, refer early. As the general public, we need to talk about it. Let people know that childhood cancer is not a death sentence, it's curable. So share with a friend to share with a friend so that we can spread the news and make sure the children come early. And as stakeholders, government stakeholders, we need to invest more in something that can be cured because these children are our future. We don't know who the next president of Ghana would be among them. So
is it expensive for children particularly? I'm quite aware about the treatment for the older people, but for the children, is it expensive?
Yes, so for the children, cancer treatment is expensive, whether it's for a child or for an adult. And it involves making sure that you investigate to know the type of cancer it is and how far it has spread. So a lot of scans, a lot of investigations need to be done so that you can give a correct treatment. And for some of the treatments, you may need surgery, you may need chemotherapy drugs, which are quite expensive, and they are not on insurance for children yet. And also sometimes you may need radiotherapy, which is also very expensive. Fortunately for adult cancers, a few of them have been put on the national health insurance, like the breast cancer, the prostate cancer, cervical cancer. So it's reduced the pressure on the adults. But for the children, we are yet to start the national health insurance. The government has shown some commitment, and hopefully we are praying that before the middle of this year, the childhood cancers will be on insurance so that our children can have affordable and available drugs to treat their cancers.
It's been a call. We've been calling on this for some time now. Is it looking promising, really?
So, they've had some stakeholder meetings.
Yeah.
Have you?
Yes.
How's it looking?
Well, it's been very promising. As I said, the First Lady is very instrumental with this policy. And we are hoping that, in fact, she has been championing it from day one. And we are hoping that these four of them has been selected. Retinoblastoma, cancer of the eye, kidney, nephroblastoma, leukemia, and then Beckett lymphoma.
Which one is a Beckett lymphoma?
So it's cancer of the immune system that usually presents with jaw swelling or swelling in the abdomen.
Okay. For the center, how are people aware that this is available, and how accessible is it? The kind of help you're giving to people, how do they know about it?
Yes, so I would like to address your question by looking at the first strategy I said we have.
Okay.
So we said we are improving treatment. Okay. So we are training health professionals, healthcare workers. Sometimes they are not able to pick it early. So the children don't get diagnosed early. And with childhood cancer, when the child is diagnosed early, there's a chance that the child will survive. So we are training health professionals. And between last year and the past 2 years, we have trained about more than 700 professionals, various cadres. And then we said also, so as we train them, the hope is that they'll be able to get it early. If they don't have the facility to treat it, they'll be able to refer it to a center where we can, Kolebu or Konfanochi, where we can treat. And then we say we want to improve on diagnosis. So money is also available for these patients when they come. We realize that they don't get diagnosed early. So money has been, the place has set fund available aside for these patients when they come, be able to do all their lab investigations, CT scans, and all those things. So previously, it took about a month to diagnose, but now, weeks, 1 week, we should have the diagnosis ready because there's funds available.
Okay.
Yes. And we also want to support them with social support as well, give them proper counseling. So nurses and doctors are well trained to help with them with their, all the emotions that come with childhood cancer, as well as making a strong case that more money, more resources need to be pumped into childhood cancer. So we are grateful to the government. They want to absorb 4 of the disease conditions, but we want more. We want a lot of NGOs, people with the wherewithal to come to our aid and help these children. As you said, we never know when the president or the first lady
or another doctor
yes.
Yeah. Doc, but how can a person want to help an institution or anybody that's interested?
So you can help in various ways. So first of all, advocacy is super important to us. So as you've heard this message, even if you don't have enough money, you have your tongue, you can spread the word, you can tell someone to tell someone, you can, if you see a child, you're not too sure, advise the person to send the child to the hospital quickly. You can also come and actually sponsor children. There are children who are not able to pay for the treatment. Sometimes they come from far. They leave their jobs, and cancer treatment is usually long. The least could be like 6 months. The most could actually be like 3 years. So it's not a short-term something. And once they get better, sometimes the parents default because there's no money to even come. Well, child cancer does well by trying to even provide transport for some of the parents. But we need to sustain it. We need to make sure that we don't lose them to follow up after all the good work that we've done. So people can come and donate to patients or the children's parents specifically, or they can also donate to the Lifeline for Childhood Cancer. Okay. The Lifeline for Childhood Cancer is an organization of which the First Lady is a patron, where they try and support children with cancer, especially those who are not able to afford their treatments, their upkeep and all that. And another way, with cancer, we also, most of the time, because their immunity is low, they need a lot of blood transfusions and all those things. So if you're unable to talk in public or you don't have enough money, you can help by donating blood to a child with cancer, okay, so that it can help them, because sometimes the treatment is so long, they exhaust all their donors during the course of treatment, so they need people to donate. And as you know, unfortunately, blood is not something we can create in a lab. We need human blood. So it's very important that at least if you're unable to do any of these things, at least you can donate blood for a child with cancer as well.
All right. Thank you very much. We've been talking to Dr. Ernestina Shandorf, Pediatric Oncologist. You find her at the Kolebu Teaching Hospital, and also been talking to Mr. Emmanuel Amankwa from the World Child Cancer Ghana. Thank you, gentlemen. Thank you, Doc. Anytime our doors are, multimedia is committed to this kind of call, and so anytime we'll be ready to accept you. Thank you so much.
Thank you very much.
All right, do stay in. Put Technology up next.